Hi everyone, my name's Curly and I'm from the Chest Clinic here at North Shore. I'm just going to do a short film for you today about TB medications and particularly about directly observed therapy and why it's so important that we do it in administering these drugs. So we're going to discuss what TB is perhaps in another presentation, but what's important to say at this point is that once TB has been diagnosed in the patient, it's really important that we start the treatment as soon as we can. And this is to stop the TB spreading to other people. It's to clear the disease from the patient themselves, and it's also to prevent the development of resistant strains of TB in the patient. Once the treatment has been commenced, it's very important that it's not stopped or interrupted unless it's been indicated by the physician treating the patient. It's essential that the treatment continues as prescribed for the entire course, whether it be for 6 months, which is the absolute minimum, or in some patients it can be up to 2 years. To stop too soon or by having sporadic and interrupted treatment can result in the development of resistant strains of TB. In short, it means that the first-line drugs that we use for TB are no longer able to kill the bacteria, and as such we need to get into the second-line drugs, which, apart from being more expensive, have their own quite nasty side effects and pose a lot of inconvenience to the patient if they have to go on them, as they are in the form of injectables. They can impact on the lifestyle of the patient quite significantly. It's important in the prescribing and administration of TB medications too that we get it absolutely right from the beginning, because if this doesn't happen, it can be disastrous. That we use when prescribing the medications for the patients, it's all based on weight, and depending on the weight can decipher how many pills the patient has with each dosing. So once the meds have been charted, the TB nurse then comes in and commences with the education session. And the education session is actually very important because these tablets are going to be given for possibly 6 months to 2 years, and with them come many side effects. So what we need to do is to let the patient know absolutely every side effect that could happen, and then they can let us know if they're having any issues with it. So when educating the patients on the TB meds, it's really important that we tell them every possible side effect that they could have. A lot of patients don't experience any side effects, but at the same time you'll get somebody else that has everything that could possibly go wrong with them. So if they know what to expect, they can then tell us, and then we can act accordingly to try and alleviate these symptoms. And so we do encourage them to tell us everything that is happening while they're taking the meds, no matter how big or small it is. As a lot of patients diagnosed with TB come from high burden countries, English quite often is not their spoken language. If required, New South Wales Health TB website has information about the TB medications in most languages, or quite often we'll use the interpreter service. If they're not available, family members, although this isn't ideal. These are the brochures that New South Wales Health have for us. So I've laid out here what we call quadruple therapy. This is standard quadruple therapy, or RIPE is its other name, and it's basically the 4 drugs that we start using in someone that's newly diagnosed with TB. They include rifampicin, isoniazid, pyrazinamide, and ethambutol. And there's a very small little vitamin B6 which we give every day to counteract one of the side effects of the isoniazid, which I'll discuss later. So the general side effects of these drugs when the patient first starts to take them is they can make them feel nauseated. Sometimes they may even have episodes of vomiting. In some cases, patients will develop an itchiness or rashes. which they do need to tell us about straight away. Sometimes all these side effects diminish after a few days once the patient has got used to the medications. But if they persist, then we need to start looking at ways to prevent these side effects from happening. Sometimes this is in the form of an antiemetic, or even for the itchiness of skin, we'll quite often give Claritine, and that can get them over this initial period, which can be quite hard on the patient in the very beginning, particularly as a lot of them are returning to work, or they have young families at home that they're trying to look after. It can take its toll. The other side effect is that they can become very tired. Anybody going on to TB meds, I encourage to make sure that they eat properly, they get lots of exercise, they get outside in the sunshine, because these are all ways that can help them deal with the medications in a better way. The only medication that doesn't affect the liver is the ethambutol, but this can have issues with patients' eyes. So anyone starting on TB treatment will always have a baseline eye check, and they're encouraged to let us know straight away if they're having any problems with their vision. Apart from the general side effects of the TB medications, some of them have very specific side effects. With the rifampicin, which is the red capsule, its main issue is that it will turn your urine and your tears an orange colour. So we always warn the patients when they're first put on this medication that that will happen, so that they don't get too distressed when it does. With the isoniazid, which is the smaller white tablets that they're on, it can cause some tingling in your fingers and your toes, and so we give them a vitamin B6 tablet, and that helps alleviate this while they're on the tablets themselves. The ethambutol, as I've said, can affect visual fields, and the pyrazinamide, of course, is just the general side effects of maybe putting you off your food, nausea, hopefully not vomiting, and we encourage the patients to let us know if they think that they're turning a yellowish colour. That could be very indicative of problems with their liver, which is why we do monitor their blood levels, liver function tests every month on a regular basis. The other thing that's very important with these medications is that the patient lets us know in the beginning if they're on any other medications at all. Rifampicin in particular can interact with a lot of different medications, particularly warfarin, and also the oral contraceptive pill. It can inactivate that. So it's very important that we have a discussion, particularly with the female patients, about finding an alternate form of contraception whilst they're on the rifampicin. The other thing I really must mention is that whilst on medications for TB, it's advised that you do not drink alcohol at all, or keep it to the absolute minimum. If you're drinking alcohol and taking these medications, it's putting a very large load on your liver, and you could do yourself some permanent damage. So we suggest you don't drink at all during this period. TB medications are best taken on an empty stomach. They should have an empty tummy 1 hour before they have the tablets, and then not eat anything for an hour afterwards. They should also not have it with any milk products. So while they're having their pills, definitely none of this, because it can bind with the proteins in the tablets. So the idea is that they don't have milk, and that includes milk and coffee, anything like that. If they're having a coffee with their tablets, it shouldn't have milk in it. So as I was saying before, with TB, it's very important that we get it right the first time, which is why we really bombard the bacteria from the very beginning. So initially the patient has 2 months and maybe more of the 4-drug therapy. And that gives us time to get back the sensitivities against the bacteria that they have grown. And depending on those sensitivities, and fingers are always crossed that the bacteria will be fully sensitive, we can eventually get rid of the ethambutol and the pyrazinamide, which means that the patient then only needs to take 2 of the drugs and generally can cut down to 3 times a week. Which is much better for the patient. It doesn't impact on their work as much or their home life, and they are generally much happier. And then they stay on this maintenance therapy for as long as it takes. Minimum 6 months, as I said, but can be longer. It can be up to 2 years, which is a very long course, but we're very aware that we do not want reactivation to occur, and this is why we are sometimes cautious with keeping them going for a bit longer. So on the ward, the TB medications are always given at 11 a.m. It gives you a good break after breakfast for the patient, so they well and truly have an empty stomach. And then they usually have lunch an hour after, so it's perhaps the best time. If you can just take note, if you notice at any point that any of the meds are missing or you've run out of stock, if you can just chase that up with pharmacy straight away. It's very dangerous to actually miss any of the drugs or be given incomplete doses, as this gives the bacteria a chance to build resistance. If you have a new patient on the ward, always let the clinic know. Quite often we already do, but it never hurts to give us a call. So thank you everyone for looking at this little movie I've done. If you've got any questions about TB, the chest clinic's open from 8 till 4:30 Monday to Friday. And we've got a lot of people down here that are interested to share their knowledge with you, and you can always get in contact with us on the clinic number, which is 31360. Thank you.